Arthritis is a wastebasket term sometimes we use to describe a global deterioration of the cartilage that covers the end of the bone. That might be rheumatoid arthritis, that might be psoriatic arthritis, it might be arthritis that's related to lupus or other systemic disease. More traditionally, we're speaking of osteoarthritis, which is just a gradual degradation of the cartilage that covers the end of the bones. And the other side of cartilage injuries involves a focal defect of the cartilage, and that's often a traumatic lesion, somebody playing sports where they injure the cartilage and you get a little pothole in the cartilage, much like you'd have a pothole in the road. Generally with arthritis, we're dealing with, or osteoarthritis, we're dealing with an older patient, and we treat them more symptomatically initially. So that would be activity modification, oral anti-inflammatories, icing, sometimes bracing, intra-articular injections of a steroid, for example. And ultimately, when all that fails, that person will move on to have some kind of a knee replacement. Cartilage injuries that are focal usually involve a younger patient, and knee replacement is not an option in those folks. And our other modalities, such as the activity modification and those kind of things, are generally not acceptable in a younger patient population. So in the focal chondral defect, we're more focused on trying to fill the defect. And that allows the patient to kind of get back to their normal activities. Whereas with osteoarthritis, we're just trying to control the symptoms because we ultimately know that person is going to go on to a knee replacement. The diagnosis of osteoarthritis is generally made by history and physical exam and then plain x-rays. And their typical patient is somebody that comes in with knee pain, with an insidious onset, not associated with an injury, and it gradually gets worse with time. A term that we often use in describing their symptoms is startup pain. A patient, when they're seated or at rest, may not have much pain at all, but when they go to stand up and begin to walk, they'll complain of pain with those first few steps that tends to improve after those first few steps. They may have swelling and pain towards the end of the day and generally describe their pain as dull and achy. A focal chondral defect may present more with what we call mechanical symptoms. That may be locking, catching, or popping. They may go through periods of times where they don't have any pain at all. They may participate in a heavier activity and then complain of swelling and increased pain. This diagnosis is made more readily with an MRI. Sometimes you can see an injury on plain x-ray, but most often we have to get an MRI to look at that. Plain films in arthritis are generally represented by bone spurs and a narrowing of the joint space, whereas a focal chondral defect, you may see no change whatsoever on a plain film, and then you get an MRI, and again, you can see what looks like a pothole where the cartilage has been knocked out over a small segment. When we're treating focal chondral defects, we typically focus on three areas. The first is a restoration of the cartilage or a repair of the cartilage. The second would be a replacement of the cartilage, and the third option would be a resurfacing type procedure. So an example of a resurfacing procedure would be in the shoulder. We find the area of defect and take a middle implant such as this and simply cover that area. In this particular example, our goal is to achieve a nice smooth surface, but again, there's remaining bone and cartilage surrounding the implant that actually grows up around the implant. They have implants that are designed for the knee, the shoulder, and even smaller joints now, even down to the level of a toe. And again, these are traditionally viewed as stopgap type treatments. We know that eventually the remaining cartilage may deteriorate and that person may go on to a more traditional joint replacement. But it's a good option for those who are in that in-between stage, a little too young for a knee replacement or a shoulder replacement, but not quite young enough, or maybe the defect size is too big for one of our cartilage repair or restoration type techniques. And so it sometimes serves as a bridge until the patient gets a little bit older and can have a traditional shoulder or knee replacement or what have you.